Hello. Our topic today is how businesses and business interests influence health. Our special guest today is Professor Ronit Endevelt, a professor at Haifa University and the former head of the Ministry of Health's Nutrition Department. Welcome.
Thank you for inviting me.
Good, good. So please get us started. Tell us a bit about yourself and your background and your very interesting path.
Okay. I started as a nutritionist in the second biggest HMO in Israel, Maccabi Health Medical Organization. I worked there as a nutritionist, and then I developed the Department of Nutrition in the Health Medical Organization, Maccabi. I worked there for more than 20 years, and I established mostly the nutritional services. And for establishing the nutrition services, I figured out that the most challenging thing to do in the nutrition profession is to make a health behavior change. And the health behavior change depends not only on the own behavior of the person, but also on the built environment and the health architecture of where we live. And beside my career in the Health Medical Organization, I always thought about researching how people behave in nutrition, researching their opinions, how to use the services the best, and what the obstacle for using it. And I found out that there's a lot of socioeconomical obstacles, and that the environment and the built environment is totally different between degree of social classes in Israel, between the Jewish people, the Arab people, and everywhere you can see the differences, that the behavior is connected very well to the built environment. And
Well,
then,
can you start by giving us one concrete example of how that plays out?
okay, for example, if you think about a nutritional desert or nutritional swamp, in Israel, you hardly see nutritional desert, as you can see in the US, but you can see a lot of places that you have nutritional swamp.
I'm not sure all our listeners know what a nutritional desert, nutritional swamp are. Can you back up there?
Sure. Nutritional desert is a place that you can't buy any food. You have to go for an hour drive or something like that to find out a place to buy food. That is rarely exists in Israel because Israel is a very tiny country. But nutritional swamp is places that are filled out with ultra-processed food, a lot of sweet beverages and snacks and all those unhealthy products. And when you go out of your house, the only thing you can see is those products. So if you don't have any alternative and they are much cheaper than the healthy product, that's the thing you're eating. And that causes the health major epidemic, which is the obesity epidemic all over the world, but also in our country. So that was one point I understood, that the behavior of people is connected not only on the self-will, but also on the environment that they are growing in and living in, and studying in, and all your life cycle. And the other
Now, I know that after Maccabi, you were at Haifa University, and then you had this very central, important role at Ministry of Health. Tell us, maybe talk about the Ministry of Health part a little bit. How were you able to use that role to address some of these concerns?
Okay, so like 11 years ago, I was asked to come and to manage the nutrition division in the Ministry of Health. And the first challenge was to help with Efshari Bari, which Efshari Bari is a program that is supposed to change the health behavior of people and also the environment. And when I looked at the program, I thought that there's a need to help people to understand which are the good things and which are the unhealthy things. And I had previous experience with front of pack labeling, because I was involved in a front of pack labeling that was initiated by the industry. And we studied it. In all those years, I was always in the academia. I did my PhD like 20 and more years ago. So beside my work in the HMO and in the ministry, I always had a position in the academia and always thought about research and evaluating everything we are doing. So when I came to the Ministry of Health, I convinced the people there that we have to think about the food and the nutrition environment in a policy way of thinking, that people are not able to decide by themselves if they are living in a toxic environment. And that brought us to the thinking about how to label the products that are unhealthy. And on that time, the talk was mainly about sugar, salt, and saturated fat. And most of those products that are high in those nutrients are ultra-processed food. And so that was a kind of a way to capture all the unhealthy products and to do like a nudge, to do like the person who come to the supermarket, it would be intuitive to find out which are the unhealthy products. And beside that, we decided to do also a voluntarily a positive front of pack labeling, which is quite unique that the country has both signs, because most of the countries in the world has either positive or negative or informative. And we had positive and negative, and the negative had also kind of informative system, and the positive is only on natural products with no added food additives, which was very a modern kind of a system to try to do it and to try to move the industry and to move the people who come to the supermarket to fill the carriage with much more healthier products.
Now, were you able to move the industry? Did it make a difference with the industry?
Yeah, sure. There was a reduction, dramatic reduction in the first 2 years of the labeling of the amount of sugar, the amount of salt that they added to the food,
Wow.
because they didn't want to get those front of pack labeling on the products. And also people bought much less products with the red labeling, especially sugar. It was reduced by 25%. And salt by 11%. So in an average, it was like a 16% reduction in products that are high in front of pack labeling. And that was evaluated by some PhD students in the Tel Aviv University. And also when we followed up on other researches that were done about it, it was quite the same or more or less the same results. So it was a success, but I must say that every success that you reach in public health, there's always some hazard that come from this side. And that brings me to the issue of commercial determinants of NCDs or commercial determinants of nutrition in my part. And that is that the industry in its initiative and its thinking is always want to get more money. So if you are prone to have much more money each year, then you have to produce much more products. And that means that we have to buy much more products. And the cheapest products in food is always products that are rich in salt and sugar. And also low wheat products. Because those are the ingredients that are very cheap. So that's why all the ultra-processed food is much cheaper than the whole food, like fruits, vegetables, lentils, the whole wheat products, and things like that. So there's always the thing that how you convince the people to buy the healthy product if they are more expensive. So there are many ways you can convince people. One of the best ways is the economical way, that it will be much cheaper. Procurement or is another way. Is like how do you reach it in health in workplaces and in schools. So you have the environment that you can create healthier environment by price and by place. And if you want to succeed in that, then you have also to think about the media environment. And the media environment nowadays is crucial a place of influence, especially with young people, but with everybody. If you think about ourselves, how many hours a day we use the cell phone or we see television, we are influenced very much by the influencers. And those are places when the commercial companies are making a lot of marketing and change the norms of how to eat food. For example, one thing that the industry is doing very well is convincing us that it's a matter of a will. We'll bring you all the unhealthy products. We'll cover it very nicely. It will be very tasty, but you'll decide not to buy it. We'll give it
Hmm.
free of charge. You come to the supermarket, we'll give you a taste of it. You can taste
Yeah.
it, you can feel it, you can enjoy it, but then we tell you, don't choose it.
Well, it's clearly a very challenging situation. Our time is pretty much up. We may have to do another episode to hear about how you're dealing with that challenge. But for now, do you have any takeaway, maybe one sentence you can leave our audience with at this point?
I think the main purpose is that there are two issues. One is what the country is doing and what especially the Ministry of Health is doing. And the other part is what the individual is doing. And both sides has its own responsibility. The responsibility of the government is to build a regulatory environment that will be easier for us to choose healthy products and difficult for the companies to invest in our healthy products. The individual part is to build resilience and to help people to decide on healthy and more nutritious part or more healthy product, and to understand the connection between food, mind, cognition, health, and longevity. And I think
Okay.
it's all.
Okay. Our time is pretty much up. So, Ronit, thank you so much for joining us. And please keep doing all those great things you're working on. Thank you.
Thank you.